Welcome. My name is Carl Rees and I'm a senior CBT therapist accredited with the British Association of Behavioural and Cognitive Psychotherapists. Today we'll be discussing what is CBT, how CBT works, what to expect from a CBT session, and what common mental health difficulties CBT can help with. We will also be looking at whether this form of therapy is right for you. So let's get started. So, what exactly is CBT? CBT stands for Cognitive Behavioural Therapy and combines cognitive therapy, which examines the things you think, with behavioural therapy, which examines the things you do. It is based on the idea that thoughts and beliefs, our emotions, what we do, and how our bodies feel are all connected. CBT can help us identify these connections and begin to unlock ways of disrupting any negative or unhelpful cycles. CBT is an evidence-based treatment, which means it has been scientifically proven to be more effective than most other types of therapy. Negative thoughts and feelings can trap you in a vicious cycle. For example, if you're feeling anxious about an upcoming presentation at work, you might start thinking, I'm going to mess this up, everyone will judge me. This can lead to emotions such as anxiety and may result in certain behaviours such as over-preparing, avoiding eye contact, or even calling in sick to avoid having to give the presentation. As these thoughts and emotions progress, you may also feel physical sensations such as a racing heart, sweating, and a sick feeling in your tummy, which in turn reinforce those negative thoughts and deepen the cycle. Over time, this cycle can form a habit, and we experience these thoughts and behaviours whenever this situation arises. CBT helps to identify these negative or unhelpful patterns and unlock ways of changing them to feel better. A CBT therapist will help you identify the specific thoughts and behaviours that are maintaining these cycles. The length of CBT treatment can vary dependent on the nature of a person's difficulties, but is traditionally more short-term in nature and provided over approximately 6 to 20 sessions. A CBT therapist can help you break unhelpful and unrealistic thinking patterns, which are called cognitive distortions. Cognitive distortions are those negative thought spirals that can make things seem much worse than they really are. Some common examples of cognitive distortions are on the screen. Your therapist will then help you challenge these thoughts and beliefs using a range of different methods called cognitive restructuring. Once you recognize these distortions, you can learn to challenge them with more realistic and helpful thoughts, which can in turn have a positive impact on your mood and in turn your behaviors. As well as working with thoughts, a CBT therapist can also help you identify and change certain unhelpful behaviour patterns. For example, if you've been feeling very depressed, you may avoid socialising, cleaning your home, or have even stopped taking a shower or brushing your teeth. Your therapist will help you identify the short and long-term consequences of these behaviour cycles and help you find practical ways of gently and slowly reversing them to help you feel better. CBT is a very practical form of therapy, and a typical session will not just involve talking about your current symptoms and difficulties, but also drawing out these difficulties to understand the connections between your thoughts, feelings and behaviours, and then taking practical steps to address these as you move towards your therapy goals. This may also involve practicing new cognitive or behavioural skills between sessions, keeping a record of your learning and giving feedback to your therapist. You should also feel supported and encouraged throughout and progress at a pace that is comfortable and right for you. CBT is a versatile talking therapy and can be used to treat a wide range of common psychological health difficulties, including depression, anxiety disorders, for example, phobias, panic disorder, social anxiety disorder, health anxiety, worry and generalised anxiety disorder, obsessive compulsive disorder, OCD, and post-traumatic stress disorder, PTSD. It can also help treat the psychological aspects of various long-term physical health conditions, like for example irritable bowel syndrome, chronic pain and injury, chronic fatigue syndrome, and diabetes. CBT can also treat various eating disorders, including anorexia nervosa and bulimia nervosa, and help with anger management problems and insomnia. CBT can also be helpful for longer term difficulties such as schizophrenia, bipolar, and personality disorder.
Finally, CBT can also assist with neurodivergent conditions, including autism and attention deficit hyperactivity disorder, ADHD.
CBT can help with nearly every diagnosis and can be delivered one-to-one in person or via video or telephone, or via group therapy or using self-help books and programs. While CBT has been shown through scientific trials to be an effective treatment for psychological health difficulties, it is important to remember that CBT isn't a magic wand or a quick fix. CBT may be more challenging if you struggle to face and experience difficult emotions or memories, or if you're looking for support with a recent bereavement where traditional grief and loss counselling may be more appropriate. Between sessions, CBT also involves trying out new skills and even confronting situations you've been avoiding, which may not be right for everybody. If you don't feel CBT is the right approach for you, you can also talk to your GP about alternatives, including EMDR therapy, psychodynamic therapy, interpersonal therapy, or traditional counselling. There are several benefits to CBT. Here are a few. It is a structured and goal-orientated therapy, which focus on specifically what matters to you and what you want to achieve in therapy. It's pragmatic. You'll learn a practical set of skills that you can use to help address your difficulties. CBT is a collaborative therapy, so rather than your therapist telling you what to do, they will work with you to find solutions and you'll be actively involved in your recovery. CBT therapists generally do not offer advice or their own personal opinion on your situation or condition. It is focused on the here and now, so working on how you feel today and what practical steps you can take to feel better tomorrow. It has a strong evidence base, meaning there's a lot of scientific research to support its effectiveness.
It is adaptable. CBT can be adapted for people with a learning difficulty or disability or low literacy, and can be tailored appropriately to meet a person's specific individual needs.
There are many resources available to help you find a CBT therapist. You can ask your doctor for a referral, search the British Association of Behavioural and Cognitive Psychotherapy's website, BABCP, or contact your health insurance company. If you're based in the UK, you can also learn more about CBT at our website, investcbt.com, and I've put a link to these services in the description box below for you. Thank you for joining me today, and I hope this video gave you a better understanding of cognitive behavioural therapy and if it is the right fit for you. What are your thoughts about CBT? Please let us know in the comments below. If you like this video, please consider subscribing. We release videos like this every week to help you take care of your mental health and improve your well-being. Thank you for watching, and I will see you again in the next video.